I'd like to talk briefly about how I view the debate and then also address the trade-offs and choices question for just a moment. I've been doing healthcare policy analysis and advocacy for longer than I care to admit anymore, since 1981. And the last time we had a huge national debate on healthcare, as everyone knows, was about 15 years ago. And I see some major differences in the debate we see now. I see some major similarities. Just for myself, 15 years hence, I plan to be happily ensconced in the Medicare program. So I don't plan to be around doing this anymore, and I certainly hope that legislators on the Hill really seriously take this opportunity to take what, in my mind, is a uniquely high quality and good and well-intentioned system and turn it into the American healthcare system all Americans deserve. If I'm ill, I would rather be taken care of here in the United States than anywhere else in the world. But having said that, we all know we have cost problems, we all know we have organization problems for the delivery system, and we all know that every person in the United States should have access to health insurance, and people in the United States should generally be covered. So that's kind of how I view all of this, and I really do hope the legislators take the time and make the opportunity here with the president to enact significant health care reforms. Now to trade-offs and choices, I'm here on behalf of the National Association of Chain Drugstores, and we like to refer to ourselves as the face of neighborhood health care. And as part of healthcare reform, we're spending a lot of time talking about something that we label medication adherence. And this is the issue that patients get prescriptions, and we know from data that of the 100% of prescriptions that are written for patients, at the end of the day, only 15% of them are taken on a regular basis as they should be. And we also know that people staying on their medications and taking their medications properly is critically important to their health and well-being, and we know that it can save the healthcare delivery system money. So as part of healthcare reform, to your trade-off and choices, one of the things we're talking about are these issues around medication adherence and the roles that pharmacists and pharmacy can play in providing what we call medication therapy management, basically coaching patients on how to properly take their medications, because we think it's a win all around for the system, for the patients, and certainly for my members who would like to be in a better position than they are now in order to help with patients' medication adherence, which will help the system and patients both.